What is likely to be the outcome of the National Coronavirus Command Council meeting this afternoon? Well, that's one of the questions as various business sectors, such as the alcohol industry, call for authorities not to impose stricter restrictions on sales. To further explain their position, I'm joined by Sibani Mngadi from the South African Liquor Brand Owners Association. Good afternoon, Sibani. You've written to the Command Council a little bit earlier in the week, of course, saying that urging them rather to use a science-based approach as opposed to knee-jerk reactions. Have you received feedback since that letter?
No, we haven't received feedback yet. We are hoping that as they meet today, they are able to look at this issue. The core issue together for us is if South Africa can complain about the decisions of other countries, the 90 countries that have implemented travel restrictions against South Africa, and they did that without any consultation, we think government should probably apply the same principle in the domestic economy in terms of consultation with sectors that may be affected in any way by any form of restrictions. At this stage, there have not been any official communication to us that there will be any new restrictions that will affect the alcohol, hospitality and tourism.
Right. In the previous measures that we've used where we do restrict the purchase of alcohol, have you had that consultation, before those measures are implemented?
Well, there have been some level of discussion, say, at NetLab. That has not happened in this case. And also with regard to the opening, we have had some level of planning to manage, especially the first 10 where we were anticipating higher number of consumers coming through at the same time, and we were able to plan jointly with government on that front. But of course, there have been those where we are shocked by bans with immediate effect, which is the second ban, as well as the third ban that was implemented in December last year. So those have come through as a shock to us, but we hope that government has learned some level of lesson with regard to how South Africa was treated when Omicron was discovered, and we hope that they will be sensitive enough to understand the impact that such major reaction or decisions, the impact they have on various economies.
Right. You've urged for a science-based approach, I suppose, in dealing with these high numbers of cases. What does the science reveal from your side as the Brand Owners Association, before we get to government using their science and I suppose a comparison of notes, so to speak? What kind of consultations have you done from a science perspective to see if there's any correlation between, alcohol bans and COVID-19 cases?
Yeah, the reality is that we have been trading for quite some time at level 1, and there have not been any link between alcohol consumption and the increase in the numbers as we are experiencing now. We do understand that this variant might as well be more transmissible, in which case government needs to look at the issue of gatherings. The number of gatherings which were increased to 2,000, there was no scientific explanation on why the country moved from 500 to 2,000 at one go, and how much impact that will have in terms of spread of infection. Certainly, the information we have in regard to the hospital admissions, it indicates that it's not rising as sharply as it did with previous waves, and therefore the argument that alcohol is being restricted in order to open space in the health system is not holding at this stage, and we would prefer that government look at much more innovative ways. Vaccine clearly is one major tool we have, a pharmaceutical one, which can be implemented, and we need to be working together on intensifying vaccination, and also government to provide policy certainty on whether the vaccine should be mandatory or not. And that area has not made any progress whatsoever. The task team, as far as we know, is not there or it's not been published. Its terms of reference and timelines, it's not clear. And suddenly then we are concerned with the issue of possible economic restrictions when the issue can be resolved through health, pharmaceutical and non-pharmaceutical interventions.
From an economic point of view and the conversations you're having with some of your members, are you seeing a recovery following the previous measures where we did see, restrictions on the purchase of alcohol?
Well, the critical thing is that for alcohol sales, this period, December period, what we call peak, it's a period where we are able to kind of determine the full year performance, and any form of restriction that you apply during the December period, it affects your overall performance for the full year. And that's why we are appealing to government that at this time, when people are on holidays, they are traveling, all of these economic activities, be it B&Bs, bars, all other interconnected economic activities, this is the only opportunity they have. If they miss this period, the full year projection is going to be dire for everyone.
Right. So what's needed here? Is it an improvement on that vaccine drive? Is it more policy clarity, especially when it comes to the legal framework and the implementation of vaccine mandates?
Yes, we think that the solution number one, of course, is to increase the coverage for vaccination. We can do that, which is what the alcohol industry is doing to support campaigns to have widened coverage. Of course, there is a debate around a mandatory element of it, and government has taken a number of decisions around COVID response under the Disaster Act. It needs to also give us guidance in terms of what needs to happen in that area. And then, of course, the general compliance in terms of people wearing masks, all of those are quite critical as an intervention. But certainly, the size of gatherings at 2,000 at this stage, it's something that we hope that the Ministerial Advisory Council as well as the NCC will look at that issue and probably give a reason why those numbers were increased and they remain at that high 2,000 and even exceeded during the political campaigns way above 2,000.
Sibani, let's leave it there. Thank you so much for your time.